Hi, everyone. Today I have with me Dr. Daina Patel, a chiropractor extraordinaire and a good friend of mine. We are going to be talking about muscle tension, back pain, something that affects us all, whether it's short term or long term. Welcome, Daina. Thanks for being here.
Thanks so much for having me here.
Okay, so first things first, tell us a little bit about yourself and the work that you do.
So, as you mentioned, I am a chiropractor. I mostly see women who have back pain. So, I focus a lot with women who have like postpartum pain, SI joint pain, people who have sciatica like symptoms, and a whole bunch of other things as well. I also have a back pain program for women who have low back pain. It's to help people get away from taking medications all the time for pain and seeing practitioners all the time, especially when you're really busy. So I especially treat women who are very stressed out, very busy, ambitious, who have got a lot of things going on and a lot of things on their plate right now.
Yeah, and it's interesting, right? Like a lot of us think of treating back pain very physically. We don't connect all the lifestyle, dietary things to pain because, conventionally speaking, we treat a lot of conditions in different silos, but back pain is definitely one of those things that is affected by so many things. So what do you find are some of the biggest contributors to back pain and muscle tension?
Well, yeah, like you said, the lifestyle factors, and that's usually what actually causes the pain to begin with. So it's like the sedentary lifestyle, or we're sitting on a desk for long periods of time, not doing enough movement, not getting up and stretching, and like things like that. And then it's also things like where we're eating and our stress and how we're sleeping that all contribute to pain, and they make inflammation if you already have it worse, and then that pain stays longer, or you feel more sensitive and you just feel the pain more.
So you touched on sleep a little bit. So let me ask you a quick question about sleeping positions. Um, is there a best position? Is there a worst position? Can you shed some light on that?
Yeah, absolutely. So the worst position is probably sleeping on your stomach.
Oh,
Definitely the worst.
it's my
I'm a
favorite.
stomach sleeper.
Yeah, it's
Yeah.
my favorite way to sleep.
Me too. But so I can help people transition. I'll give you guys a tip for that as well. The best position is either on your back or on your side. And to keep your back kind of in a neutral position while you're sleeping on your back or side is to either place a pillow under your knees. So have your knees slightly bent with a pillow under if you're sleeping on your back. Or if you're on your side, put the pillow in between the knees, and that kind of keeps your knees parallel and keeps your back kind of neutral. So you're not putting that extra pressure or tension on the back. And then if you are a stomach sleeper, one way that you can kind of transition yourself to kind of get onto your side a bit more is to use a body pillow. So when you're on your stomach, you have that pressure on your stomach, and it kind of gives you that feedback that you're comfortable in that position. So people like having that pressure on their stomach, and when you don't have that on your side or your back, you're not as comfortable. So using a body pillow and just hugging it and like just surrounding yourself around it can be a really nice transition to kind of get yourself more comfortable to sleeping on your back. So I always recommend doing something like that if you're really big on sleeping on your stomach.
Okay, I'll have to try it out. Sometimes I put my body around my husband, but he's too warm to hug in the evening.
Yeah, I get that a lot too.
And you need a cooler temperature to actually fall asleep and stay asleep. So
Yeah.
it's not really helpful. Okay, and how about posture in general? I know you have this amazing 5-day posture challenge that's available to free, and I'll link it in the comments below. Um, and I've definitely learned a lot about posture. So how much does posture, like our day-to-day posture, like sitting in front of the computer and even like at our phone, how much does that contribute to like neck tension and back pain?
So it definitely does play a role. It's not as big as people really think. So a lot of people think, oh, bad posture, that's going to lead to back pain and soreness, and that's why if things are feeling really bad. But really, it's the being in that position for long periods of time without taking the breaks. And that's usually what leads to those conditions. So it takes about 15 to 20 minutes being in one position for your muscles to kind of tighten up or to stretch out. And then you start feeling that tension because your muscles have been in that same position for so long that you need to kind of get them back to where they were before. So taking breaks is usually the best thing that you can do. So there's a lot of research that shows that posture itself doesn't contribute directly to pain, but we can relieve some of that pain and tension, because when you're like looking down for long periods of time, imagine doing that for hours on end. If you're at a computer, at a desk, if your laptop or your screen is not at the right height, you're doing that for so long because you're there for all day. So doing things like that all day, if you're doing that continuously, imagine like working 40 hours a week doing that, that's definitely going to play a role. So you can do things like make sure you're looking at the right point of your screen where it's raised to the right level for your eye level, making sure your chair is comfortable, and making sure your desk is at the right height. You can also do like a sit stand desk. And basically all those things will help to relieve that tension short term while you're working at a desk, and just watching your posture, making sure you're kind of sitting up nice and straight to have your joints kind of stacked on top of each other. Because again, that's going to put more tension onto your muscles, and it's just going to make them work a little bit harder than they have to. So then that's going to just make everything that you're already feeling a little bit worse. So moving around, getting some motion through those muscles, getting the blood flowing, that's my best advice if you're in any position. So it doesn't necessarily need to be perfect posture all the time, but if you have perfect posture, that will help you. And I do go into a little bit more detail in my 5-day challenge. So you can definitely find that link and learn a little bit more about what you can do to kind of set up your workstation, how it should be, how it should feel while you're sitting at your desk, and a little bit more detail on that.
Perfect. Yeah, and I'll link to that in the comments below. So how often would you say people should get up and move around if they are, doing computer work throughout like a work day?
My advice is at least 30 minutes. Every 30 minutes, you should, even if it's like a 30-second to 1-minute stretch, even if you're sitting at your desk and just like staying there, but at least once an hour if you can't do 30 minutes. So every 30 to 60 minutes is my recommendation, depending on, of course, if you're able to leave your desk or not.
Yeah, and it's hard, right? Like, because I know in the last 2 weeks, especially, I've been at my computer so much, and I sometimes forget to just get up. It's so easy, even though like it's a recommendation that I give to my patients all the time. I'm like, okay, make sure you're getting up at least like once an hour. But I forget to do it too, and then I can really start feeling some of the pull. Especially because like I usually sit on a backless chair like you recommend in your posture challenge, and then so
I
so
do.
to compensate for that, I honestly like sometimes come forward to my computer and do one of these things, and then I can feel it a lot in here. So like for me, getting up and like really just doing some neck rotations really helps. But it's so easy to forget. Um, are there any strategies that you recommend to remind, or do you have any strategy that you use to remind yourself to get up like every 30 to 60 minutes?
So I feel like you could kind of set a reminder if that's your kind of thing, but that necessarily, like, I know people are busy. They have a lot of reminders and things and notifications. So sometimes that doesn't work either because you just hit snooze and then you forget about it because you're busy. So something that I do, and this might not be practical for everyone, but I actually bought a desk that you can use for the floor. So I actually sit on the floor to do most of my work. And that way I'm already on the floor, so I just start stretching. So I've kind of gotten more in tune with my body. I know when it's feeling kind of tight and when I've been in a position for so long. You just have to listen to your body. It knows what it needs. And that's when I'm like, okay, I'm just going to do a child's pose right now because that's what I feel like I need. So that's what I do. I know that doesn't work for everyone, but if you want to set reminders on your phone, that's another good way to kind of remind you. And then I also tie it up with something else. So like using that reminder to also drink water or go to the bathroom. So that way you're actually doing something. So it's like you're not just moving, you're you're tying it to something else that you already have to do anyways.
Yeah.
So
Yeah, that's a good way to do it. I'm interested in this floor desk. Sounds like my sort of thing. I love sitting on the floor, lying on the floor. I'm oftentimes on the floor, so sounds perfect for me. We'll talk
yeah,
about it afterwards.
sounds good.
And so we've talked a little bit about, posture and muscle tension and that sort of thing. So what are some of your favorite tools or other strategies to address muscle tension?
That's a great question. So I use some tools at home because we can't always get to massage or chiro appointment, although those are probably my top recommendations. I use a foam roller or a massage ball myself. So those are the two tools physically to help like with releasing any of the tension or the knots that you feel. You can just kind of roll the massage ball into any knots or any tight spots, and then you can roll over or just pause over the knots and tension with the foam roller as well. So those are two physical tools that I like to use. And then there are some other things like doing an Epsom salt bath. So that's, you're getting the warmth from the water, you're getting some of the magnesium to help relax the muscles directly into the tissues from the Epsom salt. So that's a great combination. And then you can add other things in to help like calm you down with for example, lavender essential oil. I really like using that. So those are some really good things that you can do as well as other ways of getting magnesium in, like a massage oil that has magnesium in it, or a cream that has magnesium in it, or even a supplement. Of course, speak with your practitioner before starting anything like that. But those are some of the things that I really like to help relieve some of that tension instantly. And some of those things will help long term. Some of those things are more of an acute, like instant relief, and it's not going to give you much long term relief, but it's still good to do in the moment because it can help you calm down a little bit. It can help you with stress, anxiety, some other things. And those are some of the things, again, like the lifestyle pieces that will make your back pain feel worse. So it's just going to accentuate your pain anyways. So you might as well help to calm your body down, even like calming your mind down. Those kind of things can help with muscle tension and the knots and the trigger points and things that you might feel.
Yeah, for sure. And I love magnesium. It helps relax the muscles. It helps remove lactic acid. It helps relax the nervous system. It's good on so many levels, and our soils are so depleted in it. But this is not medical advice. Please talk to your practitioner before taking magnesium. And I do want to go back to some of the tools that you said you use. So foam roller, I love my foam roller. I have a love-hate relationship actually, because especially like around the IT band, it feels like awful but good at the same time. And same thing with my massage ball. So when you're talking about a ball, do you use like a smooth surface ball, or do you use a spiky ball? Are there benefits to either one for certain areas? What do you think?
Yeah, I use both actually. I have a pack. My favorite ones are the ones from Rock Balls. They're the from Rock Tape. That's a brand. They come in a set of two, with one with the smooth ball that's like kind of like a lacrosse ball. It's solid and it doesn't have that hollow inside like a tennis ball. So I don't really recommend tennis balls for that reason, because you just can't get that same type of pressure. And I also have the spikes on the other ball. So that one, it's going to be a little bit more intense for sure. So that's kind of, if you can tolerate it, you can work your way up to the one with the spikes. I always recommend staying away from the really hard plastic ones. Like the ones I use from Rock Balls, they're a little bit more like that silicone type of material. So it's a little bit less of an intense pressure. So it's not as painful. So that kind of spike is better because it's not going to hurt you as much. And then also some people like to roll their muscles against the wall, and those spikes have actually like dug into the wall and caused damage that way. So using something softer is going to be better for that as well. But I like using a mix of both. And if you want, like, if you have a tight spot, but you don't necessarily have pain associated with it, but you can feel that tension, the spikes might be a little bit of a better option in that case. Or if you are feeling really sensitive, or if it's like a smaller area, then I would say use the smooth ball without any spikes on it. And it just kind of really depends on you. Like there's no real reason why you would use one versus the other. It's It's more preference, I would say, for that.
Okay, yeah, because I don't think I've ever used my smooth ball because I always go for the spiky ball. Okay, so one last question for you. So with muscle tension often, and you just touched on this, and that's why it came to me. We oftentimes will feel it more in one area or in another than another. So like maybe someone's left side is just chronically more, that's where they feel pain more versus the right side. Even the right side is also tight. So why does that happen? Is that like a nerve pathway sort of thing, or is that like an injury? Can you shed some light on that?
So, in my experience, I haven't read any actual research that relates directly to this. I probably look some up just to see if there is any kind of trend. But in my experience, it's always been because people are either right handed or left handed, and they tend to use that side a lot. So, this, when you're like either left or right handed and you're only using that one side, you start getting overuse of that side, and then you have underuse of the other side. So, depending on the way that you're going about your activities, if you already have injuries and you keep using those sides, you're now straining those muscles even more. They're working even harder. And then they start to actually get weaker over time because they can't carry out the job the same way as before. So, that tends to happen. And then there's also the underuse. So, when you don't use your muscles as much, they actually start tightening up. So, that's when you feel that tightness and that stiffness. So I find that it's a lot to do with the handedness and how often you're using both sides. And then you start leading to muscle imbalances. So even if, like, say you're using your right side more because you're right-handed, you start getting stronger on that side because you just use that side more. So there are different reasons why that can happen, and it's very dependent on the person. But I always say, like, try your best to use the side that you're not dominant on, even if it's something small, like turning a door knob or
I brush my
like just
teeth.
lifting a floor. Yeah, exactly. Just small things to kind of give you that like that dexterity that you're not used to.
Yeah, and it's interesting that you say that because you talked about like the dominant side and the non-dominant side because different people feel it differently. Some people will feel more tension and pain on their dominant side while other will maybe because of underuse feel it on the other side. So it's so interesting how the body works like that. Okay, so I know you
Hmm.
have a webinar coming up, a masterclass coming up on back pain and some really cool other things. So where can people find you? Where can they connect with you? What are you offering these days? Tell us about that.
All right. Yeah. So, like you mentioned earlier, I have my 5-day free Better Posture Challenge. So, you can try that out and learn a little bit more about posture. And then I also have a masterclass coming up this Thursday. And all of the information for all of that stuff can be found. I'm mostly on Instagram, so you can come and hang out with me there. It's at Dr. Daina Patel, and that's my handle. So you can find out more information. You can register for all the events. I'm also doing some other collaborations with other people. So anything you want to learn about me, how to work with me, anything else, if you have any questions, you can always reach out to me on Instagram.
Perfect. Thank you, Dana, so much for being here. I will put a link to all of those things in the comments below. And one last question before you go. This we're recording this during COVID-19 physical distancing. What are some of the things that you're doing to take care of yourself right now?
Oh, lots of self-care. Basically just taking breaks as I need to. I find like I have a little bit extra time on my hands, so I'm doing things like cooking and baking and like meal prepping, spending a little bit more time either like with yoga, meditation, deep breathing. I really love doing those things. They also help kind of keep me calm and grounded and help with like the stress and the anxiety during this time. So those are my favorite go-tos right now.
Perfect. That all sounds good. And honestly, I'm finding that because like the first few days or the first week wasn't so great. Like it was very rocky, but the last little while has been a little bit better. And I find that I have less pain in general. Like I get a lot of pain and tension in here, and with the self care activities, it's really helped with with the pain. So I'm looking forward to your masterclass. I am definitely going to attend. And your posture challenge was great. So I highly recommend doing that. And again, all of those are links to all of those are going to be in the comments below. Thanks again, Daina, and have a good day.